Understanding OCD. Obsessive compulsive disorder is one of the more widely known types of anxiety disorders, but in actuality, few people understand how it works. People with obsessive compulsive disorder, or OCD, are not crazy. They simply have persistent behaviors that upset their daily lives. OCD ranges from very mild to severe, and some have even suggested that everyone has OCD, but it is simply a matter of controlling your thoughts and actions so that you can live a normal life. Obsessive compulsive disorder, OCD, is a mental illness that causes repeated unwanted thoughts or sensations or the urge to do something over and over again. Some people can have both obsessions and compulsions. OCD can affect anyone. Researchers don't know exactly what causes OCD, but there are likely many different factors involved, such as family history, biology, and life experiences. OCD, as its name implies, has two main components, the obsession and the compulsion. The obsession is usually a fear or desire, such as the fear to contamination, or the desire to be perfect. The compulsion is the repetitive behavior that is a result of the obsession. For example, someone with the fear that a loved one will die, may feel a compulsion to always count everything to a certain number. They irresistibly feel as though their loved one will somehow die, if they do not count to this number. Obsessions and compulsions can sometimes be relieved with rituals, which may help to temporarily relieve the stress. Although many people will joke that they have OCD when they are nitpicky about cleaning, or do something odd, severe OCD is truly no laughing matter. A person who suffers severely from these conditions will probably not be able to work, go to school, live alone, drive, or even go out in public. OCD is chronic, although many people try to hide their symptoms from others, and stop the compulsions at the very least. Most people with OCD understand that they are being irrational, but they just can't help it. What causes OCD to develop in the first place? While many originally thought it was due to childhood environmental conditions, it is now reported that a specific neurological problem may be the cause. More than one factor is probably at work here, and although there are treatments, there are no known cures to OCD. Here are the more common symptoms of OCD. 1. Repeatedly washing hands. 2. Protecting personal desk or locker, other personal property. 3. Reassurance the environment that others are not sick or dirty. 4. Avoiding touching dirty surfaces. 5. Avoiding the use of public washrooms. 6. Refusing to share items. 7. Refusing to eat in a cafeteria. 8. Going back and forth through doorways many times before it's okay to enter the room. 9. Avoiding using certain numbers that are unlucky or not safe. And a lot more. Getting help, however, is very important. With medication, behavioral therapy, and counseling, patients with OCD can truly start to lead somewhat normal lives once again. Talking to your doctor about your OCD concerns is the first step to controlling your life and health. At the very least, talk to a friend. He or she may be able to help you take the right steps toward treating your OCD. This disorder can be devastating, but with a little hard work, one can overcome OCD. OCD in the home. Obsessive compulsive disorder is just one of the many kinds of anxiety disorders affecting millions of people around the world. People with OCD often find that they do specific rituals, and these obsessions can make it very difficult to interact with people in public. However, if you stay home all the time, you are actually hurting yourself even more. There are many ways to OCD-proof your home in order to move forward with your treatment, and with overcoming OCD in your life, completely. First, you need to identify your obsessions. People obsess with everything from fear of dying to germs. Your obsessions will be the things you think about all the time, even when you wish you weren't thinking about them. Next, identify your compulsions. Compulsions will be things that you feel like you must do because of your obsessions. For example, you may feel like you need to clean your bathroom a certain number of times a day, or say a phrase a certain number of times repeatedly. Knowing your specific obsessions and compulsions is not difficult, but it is nevertheless the first step to helping to improve your condition while at home. OCD might become a regular part of your life, while you are at home, whereas you might be able to control yourself more readily when you are in public. Why? You may simply find it embarrassing to give in to your obsessions when you are around other people. That proves that you can actually have control, you just don't want to, for whatever reason when you are at home. To combat this, invite friends into your home often. When your home becomes, essentially, a public place, you'll be less tempted to give in to your obsessions and compulsions. And over time your brain will be automatically programmed to perceive your home as somewhere where these activities are not okay. Another great way to combat OCD in the home is to purchase a stopwatch. Whenever you begin to obsess about something, stop the watch, and when you're back in control, start the watch. Do this throughout the day, and then every night check out your total time for the day. You may be surprised about the time you've been wasting. Chart your progress, and keep in mind this waste whenever you begin to obsess. You could be doing more enjoyable things with your time. OCD affects everyone, not just you, so by stopping your OCD behavior in the home, you can work on a positive step towards recovery for yourself, and those around you. Post-traumatic stress disorder. Common among war veterans, rape victims, and others who can experience terrifying events. Post-traumatic stress disorder is a condition that is characterized by the gripping fear, persistent due to flashback thoughts of an ordeal. Post-traumatic stress disorder, also called PTSD, can hurt a person's work, social, and family lives. There are a number of horrible events that could cause one to experience PTSD symptoms. Besides those listed above, these include child abuse, violent attacks, threats, natural disasters, and accidents. In any cause, there is usually a sense of helplessness and tragic danger. However, simply witnessing a horrible event can cause PTSD. PTSD has a number of distinct symptoms that can help you diagnose as your own condition. These include nightmares about the event, avoidance of thoughts or feelings, difficulty remembering the experience, irritability, difficulty concentrating, emotional drain, guilt, feelings of distance from friends and family. Having one or two of these symptoms does not mean you're suffering from PTSD, and not everyone experiencing an event will develop this anxiety disorder. Generally, you should see a doctor if these symptoms last after 1 month. Treatment for PTSD is very important, because the disorder can cause you to miss work or school, and have trouble socializing. Having PTSD is nothing to be ashamed of. Over 5 million American adults alone say they have this disorder. PTSD affects anyone, regardless of age, race, economic status, religion, or gender, although more women than men tend to have PTSD. When something tragic happens in your life, and you cannot move on, PTSD is a likely disorder to develop, no matter who you are or what you look like. Thankfully, there are a few ways to treat PTSD. Therapy is a very good way to talk about your problems, and it can also help you from experiencing PTSD from the beginning. Remember to tell your therapist the truth about everything, and ask for advice whenever you feel like you need it to avoid nerve-wracking situations, like panic disorders or flashbacks. Medication is also possible to help people deal with PTSD. If PTSD is left untreated, the results could be other anxiety disorders, depression, sleeping problems, substance abuse, and a lowered immune system. You can win the fight against PTSD. Treatment in all forms is available to help you move on with your life, or find closure. Talk to your doctor today if you're concerned about yourself developing PTSD.